cervical erosions, a topic that is seldom spoken about, even amongst patients and between doctors and patients. What are the symptoms of a cervical erosion? What are the causes? And what are the best possible treatment options in case you are suffering from a problem called as cervical erosions? So ladies, as the name suggests, cervical erosions is nothing but an erosion or a defect or a change in the kind of epithelium on the mouth of the uterus or the mouth of the womb, which leads to various problems in your day-to-day life. The commonest way that a cervical erosion will present is a chronic vaginal discharge. So if you have been suffering from white discharge that is constantly ongoing in spite of treatment, you must keep in mind the option that this could be due to a cervical erosion. There are a lot of myths around it where people think it is because some protein is leaking or because they are weak or because their uterus is weak. Lots of such myths around it. But the simple solution to all these problems and confusions is to ask your doctor to check if you have a cervical erosion. Your doctor can easily look or have a look at the cervix or the mouth of the uterus by putting in a speculum to confirm or refute whether the vaginal discharge is originating from the cervix or a cervical erosion. What causes these erosions? Well, there are a lot of things that can cause these erosions. Sometimes it is just the fact that under the influence of hormones, the epithelium or the lining that should be inside the cervix protrudes out and occupies the outer area of the cervix. The outer area of the cervix, because it is exposed to the environment, is supposed to have a much stronger epithelium. However, when that epithelium or that lining changes to a much softer endocervical epithelium, which is columnar, it is more prone to damage. There also is a limiting line between the endocervix or the cervix portion which is inside and the cervical portion which is outside or the ectocervix, and this line is what we call as a transition zone. A transition zone between the softer internal epithelium and a slightly harder external epithelium. This transition zone is very important because this is the place from where cervical cancers normally start. Cervical cancers mostly are caused due to infection by a virus called as human papillomavirus, and hence it is very important to have your cervix checked out by your gynecologist to make sure that your pap tests are up to date and yearly pap tests have been done and they are satisfactory, and in certain cases to have your colposcopy done. We will do another short video on what a colposcopy is so that you can get more information about this test. But all in all, if you have a cervical erosion, make sure you get it ascertained by your gynecologist, get a pap test, get appropriate treatment. Sometimes your doctor might advise you to go for a cervical biopsy, in which case we will get the exact information if what you're suffering from is a benign or a non-cancerous cervical erosion, or is it a malignant or cancerous cervical erosion. In case it is a chronic benign erosion or erosion which is not cancerous at the moment, but because it is there for a very long time and we cannot ascertain when it will change sides from benign to cancerous, it is better to get such erosions removed out by a process known as a cervical cauterization. This is nothing but burning out the bad epithelium so that it does not spread out more and not cause more cells to get eroded and spoiled. These cells are more prone to cancerous changes by various infecting organisms, especially the HPV virus. I'm sure ladies, you found that this has opened up a whole new avenue about another health issue that could be presenting before you, that could be troubling you, and it could lead to dangerous complications in the future. So make sure that you get your tests done and you're up to date with your pap test. Thank you.